Hello, everyone, and welcome to today's podcast, which is part 2 of the Observership Program. So, part 1, Sasha and I discussed the Observership Program, the format, how it works, cost, and basically our thoughts on it, whether it was worth it or not. If you haven't listened to that, go ahead and listen to that first. There's a link in the caption. Part 2, we actually have someone, a very special guest, Dr. Faraz, who completed an observership program, and we wanted you guys to hear from somebody who's actually done the program, because both Sasha and I haven't. My name's Dr. Caroline, and I'm from Koju, Australia, where we help people revive, survive, and thrive in their medical career. Hello, Dr. Faraz. Welcome to another podcast.
Thank you. I'm getting used to this now.
Yeah. You loved it so much you had to come back.
Absolutely.
So in today's podcast, we're going to talk about the Observership Program. You did an Observership Program in what year?
I did mine in 2019. So started in February and it ended in May.
May, okay. And were you living in Australia at the time?
No, so I was actually here on a tourist visa. When I'd applied for the observership, it was also when I was on a tourist visa. And I was quite stressed and worried about it initially because I thought, I'm working in a hospital. Does this count as anything I shouldn't be doing on legally? Is this something I should declare to the immigration department? And then I later realized that there was nothing wrong about it because it is study. Technically, you are not being paid for it.
That's right.
It's volunteer work. If you decided not to come to the hospital every single day after paying whatever money you've paid to the hospital, they're not going to bat an eye.
No, absolutely
no one's going to care about it.
No, you've paid up you've paid the money.
You've paid the money. They don't care whether you're there or not. So you're not liable for anything.
Yeah.
And so that's the majority of people who come on tourist visa have that condition on there that says no work, study for maximum of 3 months.
Yeah.
So you're ticking both the boxes. You're not working. It's volunteer work, and you're allowed to do volunteer work as per laws. And this is technically study because you're studying the Australian healthcare system by observing. So you're not doing really any hands-on things. I mean, you're doing a bit of procedures, but that's allowed.
Yep.
And so it's not beyond the realms of legalities.
I think that's important to note because, as I mentioned in part 1 of our Observership Program podcast with Sasha, is that the rules of entry to the Observership Program, or even the structure and the cost, is going to vary from hospital to hospital. So not all hospitals have an Observership Program, but if they do have one, they decide like how long it goes for, what rotations you go into, and the cost of it. But also some might say like it's not open to people that live outside of Australia. This was particularly true when COVID hit. They wouldn't allow applicants from abroad. And the only reason being is that if they gave them a spot and then the borders were shut, it was a spot wasted, and obviously that means they lost a bit of money. But now that the borders are open, the international borders are open, more of them are opening it up to international applicants. But dare I say that some might still have that rule. So that's just really important for people to know.
No, you're 100% right. And when I started, there was no COVID. So it was a different story then. But I was also one of the only applicants who was there on a tourist visa. Because the hospital that I did it in, they do a program for about 13 weeks. And each time they take in a group of people, it's a cohort of 4 doctors, 4 IMGs. And I was the only one who had a tourist visa. Everybody else were either residents or citizens.
And so when you did the observership program, do you remember what the criteria like that you could apply for it was, what they asked?
When I did it, it was a bit ad hoc because the hospital, when I started doing the observership program, wasn't really as streamlined as it is now.
Yeah.
We've had some really wonderful people come in, make it better. But back then it was quite... it was just run the way anyone wanted to run it. Mm-hmm. So, but basically what they needed of me was my CV, my AMC MCQ pass certificate, and they wanted me to do an interview with the director.
Yeah. Did you need your English test?
They said if I could have it in case they ended up giving me a job.
Okay.
Yes, it would be good if I had it, but it wasn't a mandatory.
Okay. Now I know for a fact it's a mandatory.
Okay.
Because we mentioned this in part 1 of the podcast, but basically the way we look at applicants for the observership program, are they work ready? So that they've got the AMC 1, they've got their English test and it's still valid. And that if we were to give them a job at the end of the program, they're ready to work. They don't go, oh, well, I have to sit my English test and, I might do that in the next few months. So it essentially has become a little tactic to make it a hiring pool.
Fair enough. And I don't think that's completely unreasonable, because if you're applying to a hospital for an observership or a job, well, if you're applying to a hospital for an observership, my advice would be to apply to one as if you're applying to a job. And just like you said, having an English exam ready with you is one step closer to be able to working.
Yeah. The other thing is, like, you want a hospital that has an observership program that treats it like a hiring pool, because that means you've got a chance of getting a job. There are some observership programs around the country where they run at hospitals that barely have any IMGs there. And we've mentioned this as a strategy in part 1, that you need to choose the hospital that has more than 50% of their junior doctors are IMGs, because they desperately need you. So if they're treating the observership like a hiring pool, that's actually a good thing. That's a good sign, because they desperately need some way of hiring IMGs. Obviously at the time, did you know about this?
I knew from previous observers that at the end of it all, you get an interview. Some of them had said that you have to strive to get an interview. So I was getting a bit of mixed messages whether we get one or not, and I was too scared to actually go up and ask if I would get an interview. So when I started, the aim was to be good enough to actually score myself an interview, rather than knowing that no matter what happened, I would get an interview at the end, which I think worked in my favor, because I worked a bit harder than I would have if I'd known that regardless of what I did, I'd get an interview anyway. I think it just makes you a bit slack if you know that, oh yeah, this is going to come my way. But things here in Australia don't work just quite that way. It's not about having one good day or one bad day. Yes, if your interview is absolutely horrid, then you don't get a job.
Yeah.
But it's a cumulative approach to everything.
Yep.
And anything and everything, regardless of observership, work, your life, whatever happens here is a compilation of everything.
Yep, that is so true. So you did the observership program, and what rotations did you get put in?
So they told us that because it was a 12-week program, they said that there's 4 weeks, there are 3 weeks of medicine, 3 weeks of surgery, and 3 weeks of ED, just to get an idea of the basic medical departments. And at the end, they said maybe we might do 3 weeks of rehab, or we might see if there's anything that you wanted to do. So I ended up getting a bit more of medicine anyway. So I got rehab apart from just medicine. So it wasn't too bad. But the basic idea was that you get an idea about a medical rotation, a surgical one, and ED. And like I mentioned to you, when I did it was a bit haphazard. So I did 1 week of my medicine in one department, which was rehab. I did 2 weeks as an after hours observer, and then I did 1 week on a medical ward. So it was just all over the place. And then for my surgical rotation, I did 2 weeks of urology, and they wanted me to do orthopedics for 1 week. But because I was already starting to get a bit of familiarity with the urology department, I decided that I might do 1 more week, and the RMO actually wanted me to. And here is what I did as an extra tip. So after about 2 weeks, the RMO had finally started to, remember my name and knew that I was always going to be there because I was always there on time. I was always going to be there. So, and anything that he asked me to do, I'd do it.
Yeah.
Like, this is where I learned to break my shackles of being the most socially anxious and awkward human being. I would not know how to speak out. I would not know how to do anything. So when I got to my surgical rotation, which was my first rotation, and then I went to ED and medicine afterwards. Yes. So when I went to surgery, they asked me one fine day, it was in the first week of my observer, they asked me, do you know how to put an IDC? For people who don't know what an IDC is, it's just another name for Foley's catheter that they use here in Australia. So they asked me if I could put an IDC in. And it had been eons since I'd actually put one in. So the last time that I did was in med school, that I assisted a doctor. And that would have been maybe 5-6 years ago. But and it was a split second answer I had to give, yes or no. That was all I could think of. And I don't know why my mind decided that in that half a second, there were so many thoughts in my head. And I thought to myself that, right, I can either say no and go back to being the way I was, or I can say yes and challenge myself and see what comes out of it. So I looked at them and I said, yeah, sure. I haven't done one for a while. But if you're there to guide me, more than happy to give it a go.
Yeah.
So I think that is what is the most important thing here.
That is so true.
You have to be a yes man woman.
Definitely with a condition.
Yes,
you have
absolutely.
to be a yes person, but not do something unsafe. So that's what I used to say as well. I'll go, yes, I can, but it's been a while. But look, if you come with me and observe me and guide me, or you do one, I watch you, and then I can do the next one and you watch me. Love to do that way. And they were like, yep, no worries. And that's how I did most of my skills.
Absolutely. And the RMO who I was with was a little skeptical because, it is a Foley's catheter, and some of the patients there have issues with their urinary tract, and you don't obviously want to damage it. And he would be answerable to the registrar, who would be answerable to the consultant. So he said, how about you just watch me do this? And the next one that comes in, you can assist me in doing it. So I'm like, all right, cool. That worked in my favor.
Yeah.
And that's really how it has to be. You've just got to say, I'll give it a go.
Yeah.
I'm happy to try. I haven't done one, but I'm happy to try. But do you think you could just watch over me or just assist me in doing it, and I'll do it? There's nothing wrong with doing that.
Yeah.
Okay. And as soon as this worked in my favor, I realized that maybe I can start doing the same thing for everything else.
Yep.
There was a patient who was similarly, again, on urology. There was we used to have something called grand rounds on there. The consultants came and said, these bladder issues seem a bit neurological. Do a full neuro exam on him and see how he's doing, if there's any particular issues. So we finished our ward round, and I told the RMO, they were distributing work amongst themselves, the RMO and the intern. And I again thought to myself, right, I can let this opportunity go once again. And I turned to the RMO and I said, do you mind if I do the CNS examination? And he's like, sure, if you want to. And I'm like, yeah, no, I'm more than happy to. Please let me. So they went about doing their jobs. I have absolutely no idea how to do a CNS examination.
Oh my God.
So I pulled out my phone.
Geeky medics. Got to get geeky medics.
100%. Because someone had told me to buy that app.
Yeah.
And I
it's
bought
like
it.
$20 a year.
Exactly. And it is the best $20 you'll spend.
Yeah, it's the best. So it goes through everything, like lots of skills, even interpretation of results. And it's Australian, so it's our way. So definitely get
and
that.
They actually do follow a lot of, even for your physical examination, they follow a lot of your Tally O'Connor. So you're covered. You don't even have to read those books. You can just do Geeky Medics and you're fine. So I pulled out my phone. The patient wasn't going to rat on me, so I just left it on his table over there, and I just followed everything step by step. And I took back a 5-page neuro report to my registrar with eliciting everything that I'd done at every single dermatome, which was a bit excessive. But I'm like, well, this is the time to be excessive.
Yeah.
And he saw that. And believe it or not, he was so impressed with it. He actually went up to his registrar. And the next morning when the consultant called him, he told that this observer actually has done the most detailed CNS examination I've seen. And there is a bit of discrepancy because there's a bit of power loss on one side, but tone loss on the other. We did an MRI. Turned out poor chap had a MS, but that's a different story. But it's just that the fact that they were so appreciative that I did.
You had initiative.
Yes, that's what, and that's a very, very big thing about Australian doctors in general, local doctors here, is that they love somebody who takes initiative. They love somebody who wants to learn. And more often than not, now I won't say this about every single registrar I've worked with, but more often than not, if you are keen, then they're always happy to help, or almost always happy to help you.
Yeah. That's the thing about IMGs, because they tend to, what more likely tends to happen is they go into a unit or a team and they're yes people, but they're not yes people with initiative or being proactive. They're like, just stand there and try not to like ruffle any feathers and let essentially the intern or the resident dictate jobs to them like they're being managed. And that's never good. Like what you did was, you're a yes man, but you're going to have initiative and you're going to put your hand up for something. And then if you're going to do it, you're going to do it well and you're going to come back with the good information. That's the difference. But you don't see that. You see quite the opposite, where they're like, if I just stand here and do as I'm told, then I'm actually doing a good job because I'm not upsetting anyone. But it's quite the opposite. Yeah.
No, absolutely. And after I learned that, I decided that, okay, time to take initiative and learn, rather than just like how you mentioned, Caroline, about not being unsafe. The most important thing is that you've got to be safe while you're taking initiative. Like if they ask me to, I don't know, put a bronchoscope down someone's throat, I wouldn't say yes, sure, I'll be happy to try. I'll probably say I'd really like to see how you're doing it, because I've never done this before. Honesty, there's nothing wrong with that. If they'd asked me to do something appalling like that, I would have said, I've never done it before. Can I watch you do it once?
Yeah.
So I can learn and maybe try it the next time.
Yeah.
Or if you tell me what to do, I'll follow your instructions.
Yeah. Because you don't want to be caught out lying, and you don't want to be deemed the IMG that does unsafe things.
Absolutely.
Yeah.
So the next thing that I did was I had a couple of weeks in AMU, which is the acute medical unit, and not just AMU. Almost every ward has this, but AMU had a blood nurse that used to come at 7:00 in the morning, and I wasn't supposed to start until 8:00. So I thought to myself, I haven't done instrumentation for a while, and I certainly haven't done anything in Australia. So this might just be the option. So what I did was, for a couple of days, I went to work at 7:00, and I asked the blood nurse over there, or the phlebotomy nurse, that can I try and do a couple of bloods for you? And trust me, they will be ecstatic if you ask them that, because you're taking a bit of workload off of their entire list of people. So I did a couple of them. The first one I did, I failed. It put me back, but I thought to myself, for the next 10 minutes, I can just sit here and focus on the fact that I've completely fopped this and not try and touch another butterfly in my life, or I can just pick up another one and I will just cherry pick. So I went around and looked at a patient who had good veins, and I said, all right, I need a confidence booster. So I went to the blood nurse, asked if this patient needed bloods. Coincidentally, they did, and I got bloods from them, and that was it. I just needed that win for the day. So again, went out of this is not a doctor's job. I was not supposed to come in early to do this. I was not supposed to come in to do this as an observer. But I thought to myself, if I don't do this, then what is really the point of spending money towards something where you're not doing anything different from anyone else? That's
so important what you just said, because in part 1 of this podcast, I did mention that I do see IMGs that go to these observership programs and they just stand there like shadows, when you can't really rely on the residents or the consultants or the registrars to really take you under their wing and guide you. You've got to make your own objectives list and go in there and try to learn as much as you can. And like exactly what you did, you saw that the blood nurse comes at 7, you put 2 and 2 together and you're like, right, I'll just come in earlier and I will help. And that's how you get that's how you get your money's worth for the observership program.
You're right. And, if eventually I did, just going a bit forward, eventually I did get the job, but then had I not gotten the job, or at that point I used to think to myself, right, the worst case scenario is I don't get the job, but I'm going away with so much experience here that I can use this to brag in any interview that I get going forward in Australia. They ask me, have you done anything? I can say, yes, I've worked for 3 months in a hospital as an observer and I've done this. And I can say with absolute certainty that you give me any patient to cannulate or to take bloods from, I'm confident I can do that.
Yeah. And you actually put this on your CV and list the skills that you completed in your observership. So this is something you should highlight.
Yeah, absolutely. I completely agree with you there, Caroline, because I did actually mention every single thing that was done in my observership, which was very helpful because it would have been, I suppose, if I were going to a different hospital. But it just highlights that you've done something.
Yeah.
And if you've done it in an Australian hospital, what happens is that if you're applying for a job elsewhere and they try to corroborate this from your previous hospital, they know that you're not going to lie about anything because obviously we're not here to do that. But they always have a very easy way of finding out whether you did it or not.
Yeah.
So if you've put it down on your CV, that means you've done it. And any hospital in Australia can ask this hospital whether you've actually done it, and they'd all get the same answer that you have. So it's yes, you are losing a bit of money. I will agree if you don't get the job, but I think that there is definitely something else also that you get from it, and that is the abundance of exposure to Australian healthcare system, which you would not get working at any GP practice. You would not get working at a nursing home. You would not get working as an assistant in nursing. It's a completely different ballgame.
Yeah.
So,
the other question I was going to ask, well, it's more of a statement, but just for the listeners to note that some hospitals might say you're not allowed to do any procedures. So that's really important, is to just check with the individual hospital that runs that program, because they're all different. Now, I did talk about this in part 1, where you will come across people who just like, another observer, and not give you the time of day because they're busy, they're overworked. Did you come across any of those people?
Funny you should say that, because when I went to AMU, I was paired with an intern, and as soon as I went and spoke to him, he said, I'll just be back, bolted out the door, ran to the clinical support officer and told her, I do not want any responsibility.
Yeah.
And it could just be that maybe he was a bit intimidated that, I'd come from a different country, and he was, I don't think it was his fault. He'd been a doctor for 2 weeks.
Yeah.
Okay. Some of them are a bit nasty.
Yeah.
He was very nice to me. It wasn't like he was, he tried to ignore me, because there were a couple of shifts I got inevitably paired with him. But I could see that he genuinely was he just felt that, and often a lot of us, when we come from overseas, we've got at least a couple of years of experience under our belt, right? And he was under this impression that I probably had worked for much more longer, and just felt really scared that, how am I going to teach an experienced doctor when I don't know anything?
Yeah.
So I understood his anxiety, but the way he reacted was a little off-putting, because he didn't know that underneath whatever he was seeing, I was more anxious than he was.
Yeah. There's always a little bit of emotional maturity lacking, like that, EQ. And that's just an age thing. I definitely had it. There's no judgment. I definitely probably had it when I was their age as well. But, you do come across people that are like, I don't get paid extra for this. And that is that is a fair statement. So some might not be receptive to you. What would you say to the people that do get those? How do you work around it?
Well, see, usually when something like this happens, you've got a very preset hierarchy, or you've got a supervisor that you report to. I would say that rather than trying to get into arguments or trying to justify that it's their job or trying to get more out of them, if you see that they're not being receptive and you're on a short time period there, okay, and this often observerships are limited in time and obviously a lot of money that you're spending. So I would recommend not wasting any time. Like, yes, you give it a try, and if you see that they're not receptive, just go talk to your supervisor and tell them that I think they're just feeling a bit uncomfortable with extra responsibility. Do you think that I should be continuing over there, or do you recommend that I go to a different department?
Yeah.
When you say that you're still willing to consider working with a difficult person, they will find themselves in guilt and try and get you to change that experience, because at the end of the day, if they don't give you a job, they still don't want you to go outside and telling everybody that, oh, I got harassed by some other doctor in the hospital, because that ruins their reputation. So they'll help you.
Yeah, because essentially the observership program is a bit of a business.
Absolutely.
So was there a rotation that you absolutely loved out of all those, or you thought was so helpful and definitely worthwhile?
I'd say my urology and AMU rotations were very helpful, because urology was the first time I'd been to a theatre, OT for the first time in an Australian hospital. So there was that bit there that I got to enjoy, and it was not something that I'd done before back at home. So that's why I just needed to, that was really enjoyable for me. And the second one was AMU, because I got a lot of my instrumentation skills back. And the last rotation that I'd done after that was ED. And by the time I went to ED, I was pretty good with knowing what the instruments are called. Like, even if I didn't do anything at AMU with the instruments before taking bloods, I'd just open the drawer and just stand there and look at every single instrument there, and read a little bit about what they're called at the back, just so that if someone tells me, go grab a green tube, and if I don't know what that looks like or means or where it's kept, then it just makes me look a bit silly. So I just didn't want anything to come back to me.
So it sounds like you're always a couple steps ahead.
Yes, that's basically how you had to be, because unfortunately, as bad as it sounds, and I know people try to be a bit more helpful with their cohort of observers, they do make it seem like it's a bit of a competition. Not in a bad way, but it's just everybody's trying to look out for themselves. And I'm not saying this, I'm not asking you to be selfish or put anyone down. You be the best at your own work that you do, and not bother about anyone else. So I would give this same advice. I'll be very honest to God, that I've given this exact same advice to the other 3 observers as well. If I went through a rotation and they followed after me, I'd say, right, go do this, because I found out that this is something that you can do. And there would be nothing better than all 4 of us getting hired.
Yeah, see, and you don't come across that very often, because people are like, well, they don't want you to shine, because if there's only one job offer when they at the end of the observership program, they want to be the ones to get it. So it's like we end up hurting each other because we're so desperate for that one opportunity. Okay, so let's talk interviews. Like, first, your observership interview to get onto the program. You had an interview.
So starting with the interview for the observership, I'd come into this hospital personally, hand-delivered my CV, and it so happened that they called me the next day and said, the director just wants to have a chat with you. I think that bit of initiative is quite important if you're thinking about trying to get onto an observership or even a job later on. just try and whatever. I know that it's not easy for everybody to travel, but let's say if you're living in the city and you've got about 10 different hospitals in your metropolitan area, then just go hand out your CVs over there and tell them that if you don't have a job and if you do an observership program, I'd be more than happy for you to consider me for that. Just take what they're getting, basically. And I got called in the next day. I went in, and the director was a very lovely lady. She just basically asked me about myself, asked me to run myself through the CV, and what was my area of interest and whatnot, and what did I expect out of the observership, and then she eventually said herself that we ideally try and give an interview to each one of you at the end of this. So it's a good pathway for you to understand the Australian healthcare system. Obviously, there were no guarantees of a job or anything, but I didn't really get asked any specific questions. I got asked about my CV, and I'd mentioned in my CV that back in India I'd done a bit of volunteer work. So she was a bit more interested about that, as to what sort of work I did there, what did it entail working in India, because it's a bit obviously, given that we have a large lower socioeconomic population, she just wanted to know what we did as doctors over there.
Yeah.
So she was quite interested. So she basically asked me to run through my CV, and that in itself took us to nearly 40 minutes. And she said, I'm happy with the conversation we've had. I'll consider this as your interview, and let's get you onto the observership program within the next 6 months, because there's often quite a fair bit of a wait before you can get on.
Yeah.
Some hospitals have a wait of over an year right now. And so I got one after 6 months, but thankfully there was someone who dropped out from the cohort before, and that's when I got on.
Yeah. So you did mention, like, when you did the observership program at this particular hospital, was a bit ad hoc. They probably hadn't set their ways yet. Now I can definitely tell you that there's an intake at the end of the year for the following year. We fill in all the spots, and then if anyone shows interest that year, they have to wait till the following year. So there is, like, for example, 16 spots but 40 applicants, and not everyone can get a position. It's funny enough, and we also do ask clinical questions now because we're trying to see if they're work ready. But it's always about the interview and how they shine in that interview. So let me tell you, the best interview I had with an observer was somebody who had the least clinical experience. But this girl I was like, if there was a job, we should give it to her tomorrow, because I have no doubt that she would go in and she would dominate. She would do so well, just because the way she communicated, and she had so much insight into her strengths and her weaknesses and into the areas that she knows that she's going to need to focus on. Like, she already had a strategy and a plan for how she was going to succeed if she got a job. And so just saying that to people out there, because you get these CVs and some of them have the most amazing experience on it, even these masters in public health and all this stuff. But really, it's how you come across in the interviews that counts. Obviously, your clinical question, the answer has to have some sort of format to it and process of the way you answer it, but ultimately it is just how you come across. When the director of clinical training asked you what areas you're interested in, what did you say out of curiosity?
Well, I did mention to her, ironically even back then, that I'm thinking maybe psychiatry or pediatrics, because those were the only two areas of interest I had. And I think maybe she liked that answer, because the hospital that I applied to was always short of people who were interested in psychiatry.
The reason that I asked is exactly the last sentence you just said. So integrity and honesty is very important to come off in an interview. I looked at somebody's CV and they've had all these years of experience in cardiology. And I said, what area are you interested in? Honestly, out of all the interviews, I reckon 80% would say psychiatry to me. They would say an area of need. And I realized, like, this is a trend. These people are just saying something that they think that sets them apart. And also they think that, oh, if you say psychiatry, I'm going to give you the job more over somebody else because we need psychiatrists. And so I look, I'm like, but your CV has like 3 years of just cardio experience. In what part, you got no psych experience, in what part made you decide after 3 years of cardio you want to be a psychiatrist? And I knew you're bullshitting me. And I didn't like that. And that immediately put that applicant at the bottom because I was like, if you can't develop honesty, integrity with me in the interview process, then already I'm like, I just don't see you being the sort of resident that does shine in the system.
No, absolutely. I mean, I would say to people, if they want to say something for an IMG, which might be very hard to get into, not impossible, but would require a fair bit of work, just take a surgical, an accredited surgical position, or just to get on a surgical training program requires you, especially in urology, it requires you to be an unaccredited registrar for 5 years and a surge RMO for 3 years. So that's 8 years of you doing no training whatsoever. And then you do 5 to 6 years of your accredited training, which is 15 years of your life you're trying to be a surgeon. You just be honest. I would say that, if I had surgery as my area of interest, I'd say I absolutely enjoy surgery. And I hope that maybe one day I can get in, even though I know that it's a bit hard for international graduates to get onto a training program in a surgical field. But at least I'd like to give it a try and give my 100%.
Yeah.
If I don't get through with that, then I do have a bit of an interest in whatever ABC.
That's a great answer.
It's and it's honest. Like, like if you show your interest in surgery and then you give your next option as psychiatry, it would actually, it would actually intrigue the interviewer as well. And, at least they'd ask you why, or, just don't be absolutely bizarre with your answers.
Yeah.
Like,
and obviously, like, they've been hearing advice from other people, like, say psychiatry because Australia needs psychiatrists. So they're more likely to give you the position. And then the problem is in the interview, like 35 out of the 40 applicants are saying psychiatry. And I'm like, okay, clearly someone has shared the wrong information here. When I get asked this question, do you know what I say? I say, look, I haven't completely decided on anything yet. I actually love aspects of emergency medicine, and that's what I seem to gravitate to. And I love it because I think it fits with my personality, and I say X, Y, Z, what I like about it and why it fits my personality. But I'm not too sure about personal life and juggling a family and how I would do that. So I'm also thinking about these following things because they're more family friendly. But ultimately what I want to do is just try all the different departments, work in, each department, and then make a decision. And everyone's always been like, that's perfectly fine. And that's what you should do. You should get a taste of everything and then make a decision. And a lot of the doctors will say yes. And you need to choose something that is family friendly if that's what you want as well in your life. So I don't come in and go, I want to be a pediatrician.
Absolutely.
I don't need to lie about it. And the fact of the matter is, my answer gave a bit of personal information about me, and it gave my personality, and it gave a bit of a longer discussion, and you could hear my thought process, like, how I was thinking about a training program, where if I just said, I'm thinking about doing psychiatry, full stop. 4 words later, full stop. That's the end of the conversation.
No, I completely agree with you, because when I got asked why I wanted to do, I got asked why I wanted to do psychiatry in my observership interview, and then later on for my job interview as well. I'd given more information when I gave my job interview, but basically all I'd done was, when I got asked why psychiatry, I gave them, like you said, a bit of information about myself. And I was honest. I said, I come from a third world country where mental health is a taboo. Heck, it's a taboo here in a first world country. Forget third world countries, which is so dominated by religion and culture. No offense to any of them. It's just the way it is.
Yeah.
we tend to think of everything else apart from mental health being a medical issue, that it's unspeakable. You
Yeah.
can't talk to your own family or friends about it because you get put down for being sad, and you get called some appalling things. I used to get called a girl because I was emotional. And years later, I realized I'd be proud to be called a girl. A girl goes through so much more than a guy ever will, and has maybe 2% of their emotional resilience.
I always say in my next life, I'm coming back as a man.
Or
It's
maybe
just easier.
maybe we can do swapsies.
Yes.
So, so I always put that in my answer because that's honest. I have worked in a bit of mental health back in India, but it was just such. It was that experience was so personal that I can't fake it, because I've seen that the people that came there, they actually used to be so scared that some of their relatives might find out that they're there to see a psychiatrist. So when I saw that, it actually crushed me. And then there were a couple of peculiar cases that I saw there that tickled my fancy. And every time I talk about them, you cannot lie about these things. Your face will give it away. The change in your voice, your expression, the glint in your eye, everything will just give it away that this man or this woman's passionate about what they're talking. But just as you mentioned, if you're undecided, you don't have to fake a profession.
No.
You don't have to fake instances that never happened in your life. Just be honest. I think that goes such a long way.
Absolutely. It's just like even with clinical questions when they ask you, be honest about it. Like, don't lie your way through it. So that's what they're really testing, is your honesty and your integrity. So let's skip to your actual interview at the end of the observership program that was for a job. What was that like?
That was a bit more formal than my observership interview. I had a panel of two different interviewers. Sorry. Both of them were doctors. Both of them GPs. One of them was also the clinical director and a GP, and the other one was sort of a specialized rural GP. And I had clinical questions, but they were not entirely clinical per se. Like, not stuff like, this person's got chest pain, what are you thinking? There were more clinical questions in relation to my CV. So they basically took it apart, sentence by sentence, right? Everything that I've done. They said, all right, you said you've done this in your hospital. Tell us a bit more about that. All right, you've done this in your hospital. Give us a bit of an example of it. There was a lot of conflict resolution. There was so clinical questions based on my CV. Some of my other people from the cohort did get a couple of standard cluster of questions that you do get in an interview. Again, I would at any point when I don't know anything, I would do what I know, and I'd just say that beyond this, I would require help. And even if it is at step 2 of what needs to be done, you require help, at least be honest about it. Because you might not shine through the interview, but out of a group of 10, if you're lying your way through it and you just caught bullshitting, then you're not even on the list.
Yeah.
Whereas if you're honest that, right, I can do, I would have done this, and this, and I think I need a bit of help beyond this, you're still at least on the list, which is much better than not being on the list altogether.
You're actually a little bit higher on the list because the fact that you knew your limitations and you're like, at this point is where I would get help, but I've done all this other stuff prior, that's where they're like, amazing. And that's the thing IMGs need to understand, because that's what's letting them down in these interviews. And I know when I was interviewing for the observership program, we did do the clinical questions. Obviously, I knew how heartbreaking it was going to be to reject like more than 50% of the interviewees because there's only 14 spots. And I actually hated it because I just put myself in their shoes, and I know that feeling. I know it personally. But there were some applicants that I was like, I know you'd be good. I think I know, like, you could get your foot here, do the program, I will touch base with you, and I'll tell you how it operates here, and I can mold you a little bit that I think you would be good if you got a job with a bit of help. But unfortunately, you just have to choose the 14 best people that interviewed. And every time I'd ask a question and I could just hear that you're not owning where your limitations are, and you're sounding like you'll be fine at everything. Like I once asked a question, being an IMG, there's going to be things that you're not going to be good at because of career gap or things are done differently back home. Have you thought about what those are? And have you done anything, or have you thought about how you will rectify it? I had somebody say, well, I have thought about this, but I'll be fine because I've done X, Y, Z, and yeah, it shouldn't be a problem. And I'm like, and what they've done had nothing to do with the issue they identified. And in my heart, I was like, don't say that. Like, I can't vouch for you now. And that's the classic mistake that they make. They lie so they don't show their weaknesses. But the best thing you can do is show that you have limitations, but also show that I have a plan on how I'm going to correct these limitations as I'm working. And they're the ones that you hire.
Yes, and there's nothing wrong in being humble. Humility goes a long way. And I recognize that a lot of IMGs have plenty of experience from where they're from, back in their homes. Some of them have decades of experience, and leave all of that behind and then decide, restart their life basically as an intern is quite hard, and they're rigid and set in their ways. But it's a learned behavior. If you've learned to be this way, then you can learn to be the other way as well. It's difficult, but it's not impossible.
Yeah.
So I would say that trying to flaunt your achievements is very different from bragging about yourself.
Yes.
Right? If you've achieved something in life, you talk. Of course, if you don't toot your own horn like a very sensible person told me today, then no one else will.
Yeah. Was this sensible person me?
Yes, it was.
The other thing I wanted to mention about observership interviews is put in maximum effort to prepare, just the same way you would for an actual interview that would land you a job. And the reason I say this is because I know people think, oh, it's an observership, whatever, like it's not an actual job interview. I won't go all out. I actually had somebody, it was an online interview. I had somebody basically interview, I swear they took me to a basement. Like they were in some sort of weird ass basement, and they, like the camera was like down and they were up, and there was so weird angles, and they were like, oh, just one second. And then they're moving, shuffling things like one second. And I'm like, if you had an interview at a set time, make sure you're available. Make sure you're in a set room. You're ready to go. Your computer is set up. Don't take me into some weird basement.
Absolutely.
And just because it's the observership program, you don't think the stakes are high. But I'm telling you that they are high, because there's like 50 applicants and only 14 spots. So if you're not treating it professionally, why would we give you a spot? Because I don't think you're going to treat it professionally when you get to the hospital, if that's your attitude in the interview. So really prepare like it is a job interview, because this may, like if you haven't listened to Dr Faraz's IMG success story, because he did the observership program, which landed him a job, which got him into this hospital that he did his WBA in, and now he's on a psych training program there. So the observership is where it led him to all his success. So you need to treat it like it could potentially be the stepping stone to your entire career.
Absolutely. And it's that foot in the door that you're looking for. And like Caroline said, for all intents and purposes, your observership is your job. Treat this like your pathway to a job, because if you are genuine, if you are receptive to what they want from you, if you are passionate about the work that you're doing, there is no way that they're not going to see it. And once they see that there's somebody that interested, who's so keen on learning, who's willing to change their ways if that's what it's needed for them to adjust into a new healthcare system, and if they're trying to just do the right thing by the patient, who is obviously the number one priority, then there is no way that you will not land a job. One day or the other, you will get a job. Maybe not in the same hospital. It might take you through a convoluted loop, but believe me when I say this, it will always, always come back to you in a good way.
Yeah, totally agree. Final thoughts. Do you think observerships are worth it, and do you recommend them?
I think so. I definitely believe they are, because just as how I'd mentioned in the beginning, that there's two ways that they can go, that you either get the job or you don't. But either way, you come out with a huge chunk of experience of the Australian healthcare system that you probably had no idea about before. Yes, it may seem like you've lost a bit of money or a chunk of money and didn't even get a job, but in all fairness, none of these observerships actually promise you a job.
No.
They promise you an interview maybe, but not a job. So don't get disheartened if that doesn't happen, because you still have something to put on your CV. You still have something to talk about in your next interview and say that this is what I've done, this is what I've done. And if they ask you, why do you think you weren't hired in that interview, or why do you think that you weren't successful over there, then just be honest. Just say, I think I just had a bad day in the interview, and maybe that's what it was. But or if most interviews actually give you feedback on which areas you've lacked in if they don't hire you, so always try and get that from whichever hospital you apply to.
That's a great suggestion. Always ask that if you could get feedback on the interview, like what you didn't do well, and they could email that answer to you.
Yes, and then you just build on it, and that way, if at all a question like that comes up next time, then you know that you can be honest and say, this is what had happened, and since then I have done this to correct all my faults. And like I said to you before, is something about Australians and people taking initiative. They just love somebody who tries to take responsibility, who owns up to their mistakes or their faults. And it basically just humanizes all of us when we admit that we lack in something, because that's what we are to err as human. So I would say just be honest about your replies and work hard. Don't leave any stone unturned. That's what I would say for observership. And if you get an opportunity, 100% do it.
Well, thank you so much for giving up your time, because I know you're super busy, and sharing your wonderful experience to our listeners. I'm sure they've taken huge amounts of information from this, and probably just hearing your experience gives them a bit more of an understanding and a strategy. So we really, really appreciate having you on.
No, I'm glad that I could be here. More than happy to. And like I said, always good to share information around and help as many IMGs as possible.
Yes, thank you. So if you're not already following us on our social media, we have a Facebook and an Instagram. Just type in Code U Australia and hit the follow button. More importantly, we have a YouTube channel, Code U Australia, where all these podcasts go to, and they tend to go there a bit earlier than the social media platforms. So if you haven't already subscribed to that channel, go to YouTube and hit the subscribe button. I hope you found this super informative, and we'll catch you in the next podcast. Bye.
Bye.